Here is how a hematologist describes this disease. Porphyria is a predominantly female disease. With porphyria, disturbances appear in the synthesis of hemoglobin, and toxic substances, porphyrins, accumulate in the body, which affects the nervous system. There are several types of porphyria. For example, one of the most common and studied is the acute intermittent one. This is when a woman's body is suddenly attacked by unbearable pain, which even the strongest painkillers do not relieve. Bellyache comes, lower back, arms, legs, and lungs hurt, and the human dies. There is a relatively affordable cure for acute intermittent porphyria today: genetically modified blood. After introducing it into the vein, the attack passes and the person recovers. No one knows when the attack will recur. If you follow some rules, avoid the sun, which triggers attacks, avoid nervousness, and don't eat garlic, for acute intermittent porphyria, another attack may not happen at all. Some skin diseases make people unrecognizable. The sun disfigures their faces. Out of fear of the sun, and also because the medicine for acute porphyria is based on blood, patients with porphyria are jokingly called vampires. But it's no laughing matter for them. Altered shape of ears and fingers, intolerance to garlic and alcohol, photophobia, aggressiveness, just all the signs that people for several centuries before us observed in porphyrics, and which were transferred to the legends about vampires. The disease was rare, so that its carriers became outcasts in any community. However, people with the disease are still stigmatized. They become the object of jokes about vampires from friends and relatives. Suffice it to say that porphyria is still colloquially referred to as a vampire disease. Our ancestors were observant enough to understand that blood disorders are the source of the disease, but they did not have our knowledge of enzymology, the science of enzymes, and genetics to understand that porphyrics have little in common with bloodsuckers. It is believed that porphyria is a rare genetic pathology. Moreover, the factor of heredity is most important. But except for genetics, the role of concomitant circumstances and lifestyle is also important. The fact is that almost 85% of carriers of the abnormal gene live their lives without knowing about their disease. And the manifestations of photodermatitis on the skin are considered a simple allergy. But as soon as some kind of failure occurs in the body, an exacerbation can occur. Most often, manifestations of a disease are provoked by strict diets, stress, medication, contact with pesticides, for example agricultural fertilizers, or work in hazardous, including chemical industries. Hormonal profile change in women associated with the onset of menses or pregnancy, infectious diseases, especially earlier viral hepatitis C or alcohol intake. People with porphyria usually end up in the hospital with complaints of acute paroxysmal pain in the abdomen that does not have a clear localization, as well as nausea, vomiting, and constipation. All of these signs point to surgical pathology, so diagnosis and treatment may go in the wrong direction. For example, an incorrect diagnosis is often made, even surgical interventions are performed, attempts to remove appendicitis, and so on. With an incorrect diagnosis and therefore treatment, acute porphyria in 60% ends tragically, and timely diagnosis and adequate therapy save almost all patients, returning them to a full life. The disease is included in the list of orphan, that is rare, and incurable diseases. Porphyrias, or hematoporphyria in medicine, is a group of diseases that are characterized by a violation of pigment exchange due to a defect in proteins enzymes involved in the production of hemoglobin of red blood cells, and the accumulation in blood, in the liver, spleen, and bone marrow, of intermediate products of hemoglobin synthesis toxic to the body, porphyrins. Hemoglobin is responsible for the transport of oxygen molecules in the body to cells, and is an integral part of red blood cells, erythrocytes. It imparts the characteristic red color to the blood. It consists of two parts, a protein globin and a group of heme, synthesized with the participation of various enzymes, the defect of which is congenital or acquired and causes porphyrias, diseases characterized by impaired hemoglobin synthesis. Synthesis of the non-protein part of hemoglobin, heme, is produced in the liver and bone marrow. In porphyria, there is an accumulation of porphyrins, substances intermediate in the synthesis of hemoglobin. Their accumulation in various organs provokes the onset of many painful symptoms, including in the skin. This is due to the fact that they are able to absorb the energy of solar radiation and cause skin photosensitivity. Acute intermittent porphyria is dangerous, scary, and deadly. It destroys a person from within. In the acute form, the internal organs are destroyed, and in the cutaneous form, the skin itself is destroyed under the influence of ultraviolet radiation. Unfortunately, there is no cure for cutaneous porphyria. There are aerosolized preparations that are applied to the skin. This lets such patients be exposed to the sun for a very short time. Porphyria cutanea tarda is a relatively common hepatic porphyria that predominantly affects the skin. Liver disease is also common. Porphyrins accumulate, usually due to hyperphoramia, but also under the influence of alcohol, smoking, estrogen, hepatitis C, or HIV infection. Symptoms include vulnerable, easily blistering skin, mostly on exposed areas of the body. Diagnosis requires detection of porphyrins in urine and feces. It is important to differentiate the disease from acute cutaneous porphyria, hereditary coproporphyria, and mixed porphyria. There are two main types of porphyria cutanea tarda. Form 1, acquired or sporadic, 75% to 80% of cases. Form 2, hereditary or familial, 20% to 25% of cases. There is also a rare type 3, which is responsible for less than 1% of cases. In type 1 porphyria cutanea tarda, the genetic predisposition is unknown. The disease usually manifests itself in middle age or later. In type 2 porphyria cutanea tarda, the disease develops at a younger age, occasionally even in childhood, and is hereditary. Additional factors are required for manifestation of particular signs of porphyria. Such factors include increased levels of iron in the liver, alcohol use, hepatitis or HIV infection, estrogens, and smoking. Types 1 and 2 are the main forms of porphyria cutanea tarda. Their triggers, symptoms, and treatment are the same. The main therapeutic measure for cutaneous porphyria is to limit the patient's stay in the sun. Erosions should be treated with antiseptic agents to prevent infectious skin lesions. With porphyria cutanea tarda, the patient is prescribed plasmapheresis and drug therapy. Preventive measures include limiting sunlight exposure, alcohol consumption, smoking, taking estrogen, and iron-containing medication, and effective treatment of concomitant hepatitis C and HIV infections. It is difficult for people who do not suffer from cutaneous porphyria to imagine that the sun is not a friend but an enemy, that it is impossible to enjoy its rays on a warm summer day. Here is an example of how a patient with cutaneous porphyria lives. A certain Sophia. Sophia's house has blinds, blackout curtains, and fans. She is also sick from the heat, and the sun hurts the skin, reflected from the neighboring White House. On hot, sunny days, Sophia curtains everything, turns on the fans, and, according to her, sitting in the bunker waiting for the evening. When it gets dark, she can go out of the house, get some air. Sophia's protection, umbrellas, healing ointments, sunscreen, special with a physical filter, whitish, others do not help, hats, caps, long sleeves. Recently, she found out that there are clothes with a sunscreen and ordered one for herself. According to Sophia, she is ready to at least smear herself with whitewash, put on anything, as long as nothing hurts. In September, an ulcer appeared on her leg again. It is not clear where it came from. It hurts a lot and takes a long time to heal. That's why lately she just lies at home with her feet on the pillow. To be continued in the next episode. Stay tuned.